Subclavian artery was having three parts. Yeah, that I know. Part 1, part 2, part 3. Remember, first part will give you three branches, which we have to memorize. So first part will give three branches which you have to memorize. What about the second part? Not very important. Third part not very important, but first part is important. So what is first part giving? Let us see what it is giving. Here it is the same diagram but with more details. Same diagram means can you see clavicle bone here? Clavicle, yes, I can see. Can you see there is one artery under clavicle? Artery under clavicle. Are you talking about this subclavian artery? Yes. And then it will enter the axilla to become the axillary artery, you remember? Yes, I remember. Now, if you say this is the subclavian artery, it is covered by which muscle? It is covered by this muscle, which is called as scalenus anterior. Now, if that is a scalenus anterior muscle, then it is dividing the artery into three parts. Yes, that is the point here. See, this is going to be the first part of the artery here, and this is going to be deep to that is second part of the artery, and then there is a third part. So this is the first part of the artery and second part of the artery and third part of the artery. Yes. You want to talk about the first part branches? Yes, they are called width branches. Width branches. Let us discuss width branches from the first part of subclavian artery. What is this width branches? Tell me. You will see here now. In the width branches, this is V going up. What is this V going up? That is a vertebral artery to supply circle of Willis. You are trying to tell me the branches of the first part of the subclavian artery in the neck region? Yes. And they are width branches. Yes, this is V which is going up to supply circle of Willis. This is vertebral artery. And what is the I for? I. Let me show you I. This will be the I. And what is I? I is the internal thoracic artery to supply thorax. You are telling that internal thoracic artery will go down to supply thorax now. Yes. And what is the T branch? You say width branches, V-I-T. Who is the T branch? T. You see here. There will be a T branch also. What is this T branch? That is called as the thyrocervical trunk. What is that? That is called as thyrocervical trunk. So V and I and T branch. Yes. What is this thyrocervical trunk doing? What is a thyrocervical trunk doing? That we will discuss by drawing a diagram, but that diagram will come later. So you have just discussed V, I, T branches from the subclavian, and for that you will draw the diagram later. Yes. Okay, we'll wait for that time. What is happening right now? Right now you are supposed to talk about the 8 branches of external carotid artery. 8 branches of external carotid artery. Who are they? Let us see. Who are they? You are having a common carotid artery. Yes. It is bifurcating into 2 branches. Name. There is one internal carotid artery. Yes. And then there is one external carotid artery. So this is the external carotid artery. Yes. Okay. You are telling that this is common carotid artery. Yes. Giving the external carotid artery. Yes. And there is also internal carotid artery. Yes. Actually, common carotid artery is bifurcating into 2 branches, and we are focusing upon external carotid artery. So external carotid artery, you want to see the branches. Yes. 8 branches. Yes. 3 anterior and 2 posterior and 2 terminal and 1 medial branch. What are they? Let me show you. There are 3 anterior. What are the 3 anterior branches? See, there is 1 anterior branch of external carotid, superior thyroid artery. There's another branch to supply the tongue, lingual artery. There's another branch to supply the face, the facial artery. So you're telling that there are 3 anterior branches of the external carotid artery here? Yes, they are. Superior thyroid artery supply thyroid, and lingual artery supply tongue, and facial artery supply face. Then what are the 2 posterior branches of external carotid artery? The 2 posterior branches, yes. See, one of them is going behind the auricle, so posterior auricle, and other is going to the occipital bone, so occipital artery. You are telling two posterior branches of external carotid artery now. Yes, names are occipital artery going to occipital bone posteriorly, and behind the auricle you have posterior auricular artery. You are telling that external carotid artery gave two branches. One is behind the auricle, so posterior auricle. One is to the occipital bone, occipital artery. Then what are the two terminal branches? Two terminal, yes. Okay, let me show you. One of them will supply the maxilla bone, so maxillary artery. One of them is supplying the temporal bone, so temporal artery. Full name, superficial temporal artery. So now you are telling two terminal branches. Yes, name. Maxillary artery to supply the maxilla bone and temporal artery to supply temporal bone, which is the full name. Superficial temporal artery. So two terminal, yes, two posterior, yes, three anterior, yes, but there is a eighth one. Who's the eighth one? Eighth one you cannot see here. It will be going medial. It will be going medial, cannot see, no. So what we should do? Draw it yourself. I'll draw myself, yes. But what is the name? Name of the eighth branch is ascending pharyngeal artery. It will supply pharynx by ascending course. So can we see that ascending course of pharyngeal artery then? Yes, we'll do it, but here you see some more things. What? Can you see facial artery supplying superior labial artery? Why you are focusing upon superior labial only? Because I have a description later. So you are telling that facial artery giving upper lip supply superior labial artery? Yes. That superior labial artery will supply Kieselbach plexus, Little's area of epistaxis. Oh, external carotid artery will give you the facial artery, and facial artery will give you superior labial artery, and superior labial artery will supply the Kieselbach area of Little's plexus. Yes. Can we discuss Little's plexus now? No. Why? Because it is due to come. Oh, it is due to come, fine. Then what are we doing right now? Draw the 8 branches of external carotid artery. 8 branches of external carotid artery. Yes, okay, let me do it. This is the external carotid artery now, and it is giving 8 branches, which are 3 anterior branches. Name them. There is one superior thyroid artery supplying thyroid gland, and it is the first branch of the external carotid artery. You are telling this is external carotid artery now? Yes. Giving 8 branches, 3 anterior. Yes. And the first one is superior thyroid artery, which is the first branch of external carotid artery to supply thyroid gland. Yes. Then I have lingual artery. And what is the lingual artery doing? Lingual artery supply the tongue. And then I have facial artery. And what is the facial artery doing? Facial artery supply the face. Not only face, but it is also giving superior labial artery. And what is the superior labial artery doing? It is supplying some branch to the Little's area of epistaxis along with the upper lip. Okay, fine. 3 anterior branches. Now what are the 2 posterior branches? The 2 posterior branches, let me show. One is going behind the auricle, and one is going to the occipital bone. So the one which is going to occipital bone is occipital artery, and the one which is going behind the auricle is posterior auricular artery. So posterior auricular artery, yes. This one, yes. This is posterior auricular artery, and this is the occipital artery. 2 posterior branches, yes. What are the 2 terminal branches? 2 terminal, I'll show you. 2 terminal. This is one terminal, this is the other terminal. Who is this other terminal? Maxillary artery, supplying the bone maxilla. And who is the other terminal branch? Temporal artery, superficial temporal artery. So that is the superficial temporal artery going up to supply the temporal region. Yes, temporal bone, temporal region, 2 terminal branches. But these are 7 branches only. Where is the 8th one? 8th one is the medial branch. Where is the medial branch? It is here. It is going medial. So this is ascending pharyngeal artery. Yes. And it is medial branch. Yes. So we cannot see it because we are looking from lateral view. Yes, because we were looking from lateral view, it is difficult to see the medial branch, but I have shown it. So ascending pharyngeal artery. What is ascending pharyngeal artery doing? Going medial. It is supplying the pharynx. And what else it is supplying? It is also supplying the eustachian tube, and it is also supplying the tonsil. It is supplying tonsil also. Yes. Okay. You are telling that there is a medial branch of the external carotid artery which is supplying pharynx because the name is ascending pharyngeal artery, but it is also supplying eustachian tube. Yes. And it is also supplying tonsil. Can you tell me which other arteries supply tonsil? Tonsil is highly vascular, but major supply is from facial artery. If you say tonsil is highly vascular and major artery from facial artery, what branches facial artery will give to the tonsil? Facial artery will supply tonsil, lingual artery will also supply tonsil. Oh, now lingual artery is also supplying tonsil. Yes. So lingual artery supply tonsil, facial artery supply tonsil, ascending pharyngeal artery supply tonsil. There are so many arteries supplying tonsil. Yes, even the maxillary artery. Even the maxillary artery supply tonsil. Yes. What is happening? Can I have one diagram for tonsil supply now? Yes, we will discuss. But maxillary artery will supply tonsil, facial artery will supply tonsil, lingual artery will supply tonsil, ascending pharyngeal artery will supply tonsil. You need a separate diagram for tonsil. Before you do that, you have to discuss the branches of maxillary artery. What about maxillary artery? It has 3 parts. So you want to discuss the 3 parts of maxillary artery now? Yes. Okay, then do it. See, this is first part of maxillary artery, there is second part of maxillary artery, there is third part of maxillary artery. Where? Let us magnify and see. You are telling that this is the external carotid artery. Yes, that is external carotid. And it is giving terminal branch which is called as the maxillary artery. Yes, this is first part of maxillary artery. Okay, this is first part. Then what is that yellow color? That is the second part of the maxillary artery. Second part. And what is that blue color? Blue color is a third part of maxillary artery. Third part of maxillary artery. So maxillary artery has 3 parts. What is the first part giving? First part, I'll tell you. Inferior alveolar artery to supply lower teeth. It is giving inferior alveolar artery supplying lower teeth. Then who is giving the superior alveolar artery supplying upper teeth? That will be third part. So third part is supplying upper teeth. Yes. By giving superior alveolar artery. Yes. Then what is the second part doing? Second part, don't bother because it is not important for our entrance purpose. It is not important. No. So we have to take a risk. Yes. We don't want to talk about second part. No. Okay, then talk about the first part. First part I told you, it is giving inferior alveolar artery to supply lower teeth. And third part is giving superior alveolar artery to supply the upper teeth. And first part is giving one branch which you already know. Do you know some artery passing foramen spinosum? Foramen spinosum. Yes. Are you talking about middle meningeal artery, which is going deep to pterion? Yes, middle meningeal artery going deep to pterion is a branch from the first part of maxillary artery. Yes, we'll draw a diagram for that. So first part of the maxillary artery gave you some middle meningeal artery passing foramen spinosum going under the pterion suture. Yes, that is the one. Can we discuss some branches of third part now? Yes, third part, let us discuss some branches. You have to remember sphenopalatine artery. Which one? Sphenopalatine artery. And why? Because it is supplying Little's area of epistaxis. Little's area of epistaxis supplied by sphenopalatine. Yes. There is one more which will supply Little's area, which is greater palatine artery, branch of descending palatine artery. So you will have a greater palatine artery branch of descending palatine. Where is descending palatine coming from? Descending palatine is from the third part of the maxillary. So third part of maxillary. Yes. This diagram is complicated. Yes. So we will draw it ourselves. Yeah, you can draw. No problem. But tell this is the sphenopalatine artery there. So that is sphenopalatine. Yes. And this is descending palatine. Yes. Coming from third part. Yes. So third part of maxillary artery gave 3 branches. Yes. Sphenopalatine to supply little area of epistaxis, then descending palatine which will then give greater palatine to supply little plexus, and then this is superior alveolar artery supplying the upper teeth. Yes, this is the diagram which we are supposed to draw. So this diagram, yes, this is maxillary artery which is giving middle mandibular artery first part, yes, and this is first part giving inferior artery to supply lower teeth, yes. Second part you don't bother, yes. Third part which is giving you some sphenopalatine artery supplying little area of epistaxis, yes, and then descending palatine artery giving greater palatine artery, yes. Who is this? This is continuation. Continuation of what? Maxillary artery. Maxillary artery. What is the name of this artery? That you draw and discuss. So we are now talking about the external carotid artery giving the maxillary artery. Yes, terminal branch. So external carotid artery giving the maxillary artery terminal branch. Maxillary artery terminal branch of external carotid artery. Yes, it is having three parts. This is part 1, this is part 2, and this is part 3. Oh, part 1 to 3. What is part 1 doing? Part 1 gave you some branch which is supplying lower teeth. Who is that? Inferior alveolar artery. If you say this is the inferior alveolar artery which is supplying the lower teeth, then I think first part gave you some middle mandibular artery also passing foramen spinosum. Yes, passing foramen spinosum. It was the middle mandibular artery, and now it will go deep to the pterion. It will go deep to pterion. Okay, two branches from the first part of maxillary artery. Yes, right. Second part you don't bother. No. What about the third part? Third part will pass the inferior orbital fissure and become inferior orbital artery at the floor of the orbit. Floor of the orbit, yes. Like maxillary nerve becoming inferior orbital nerve? Yeah. If you remember, maxillary artery like maxillary nerve will be passing inferior orbital fissure. Maxillary artery like the maxillary nerve is passing inferior orbital fissure to continue as inferior orbital artery and nerve. And inferior orbital artery and nerve are at the floor of orbit. What is it doing there? Do you remember what the nerve was doing? Supplying the upper teeth. Supplying upper teeth how? By giving some branches. Which branches? Anterior and posterior. What is this anterior posterior? Don't you remember the nerve? Same branches. What is same branches? Anterior and posterior. Superior alveolar arteries. So anterior superior alveolar artery? Yes. Posterior superior alveolar artery? Yes. Middle superior alveolar artery? Yeah, you can say middle also, no problem. Okay, so there is anterior superior alveolar artery, middle superior alveolar artery, inferior superior alveolar artery supplying upper teeth. Yes. So third part of maxillary artery supply upper teeth. Who is supplying the lower teeth? First part. Lower teeth are supplied by first part and upper teeth are supplied by the third part. What are the other branches of third part? Other branches of third part are, one is descending palatine artery, and descending palatine artery will give you greater palatine artery which will supply the little area of epistaxis. You are telling third part of maxillary artery gives some descending palatine artery? Yes. Which will give greater palatine artery? Yes. And which will supply little area of epistaxis. I think there was one more artery supplying little area. Yes, it was given here, sphenopalatine artery. So sphenopalatine artery, yes. Sphenopalatine artery is a branch of the third part of the maxillary artery to supply the little area of epistaxis. Yes. Can I see the diagram for little area of epistaxis? Yes, of course, you will see that. But first, you have to talk about the tonsil artery supply. Tonsil artery supply. Yes, I remember some branches. Let me see. As I'm talking about the tonsil, you have seen some branches. Do you remember them? There was the major artery from facial artery. Facial artery is a major artery to supply tonsil. It will also give ascending palatine artery. So facial artery is the major artery and it is also giving ascending palatine. Then who is giving descending palatine? You remember descending palatine given by Maxillary artery, it is supplying the tonsil. So maxillary artery give the descending palatine artery supplying tonsil. Yes. I think lingual artery was also supplying. Yes, of course. Lingual artery will give you dorsal lingual artery and supply the tonsil. So lingual artery give dorsal lingual artery. Who else is supplying? Do you remember ascending pharyngeal? Supplying tonsil. Let's draw the diagram. You want to draw the diagram? Yes. Tonsil. Yes. Okay. But you have to start with external carotid artery again. And it is giving some branches. Like this time I am focusing upon lingual artery. And I am also focusing upon the facial artery. Okay. I am also focusing upon this ascending pharyngeal artery. Yeah, okay. Ascending pharyngeal artery then. And also I am focusing upon the maxillary artery, the terminal branch. Yes, terminal branch, maxillary artery. So they are all going to supply tonsil. Yes. How? You see, we have discussed the branches. First we told ascending pharyngeal artery supply tonsil. It also supplies pharynx, eustachian tube, but tonsil. Then the lingual artery is giving dorsal lingual artery. So lingual artery giving some dorsal lingual artery to supply tonsil here. Yeah, that is the tonsil and it is supplying. Otherwise, remember the major artery is facial artery. And facial artery giving direct branch, it is also giving indirect branches. How? By giving a branch which is called ascending palatine artery. So it is giving ascending palatine artery to supply palate. Yes. So facial artery gave a direct branch to tonsil. I think this is the major supply. Yeah, that is the major supply to tonsil, facial artery. But it is giving not only direct branches but indirect branches also. Like this is ascending palatine artery to supply palate, but that is also supplying tonsil. So ascending palatine artery supply tonsil. I think there's a descending palatine artery also supplying tonsil. Yes, it is. Actually, it's a branch of maxillary artery. Maxillary artery gave a descending palatine artery, and that descending palatine artery is also supplying the tonsil. So now tonsil is supplied by not only ascending palatine artery but also descending palatine artery. Yes, actually descending palatine artery is a branch of maxillary artery and ascending palatine artery is a branch of facial artery. So both the palatine arteries supply the tonsil and major supply is facial artery. Why do you want to know all this? What is happening? Why? Because you are ENT surgeon and you are removing tonsillectomy. So ligate the arteries. You should know the arteries, then you can ligate, isn't it? Okay, that is why it is important. Yes. Not that is why. It is important because PG entrance exam questions are coming. Of course, it is important you being a doctor knowing all this, but this time what is important is, can I tackle the MCQs in the entrance exam or not? That is why it is important, you know. Before you become ENT surgeon, you should already have become ENT surgeon. Means before they give you a PG seat for becoming ENT surgeon, you are already ENT surgeon. That kind of knowledge you should have, you know. Such questions coming. Anyway, have some good idea. Now, nose, causal back. I think it is called Little's area of epistaxis. Yes, Little's area of epistaxis. And this is some recently asked questions. Yeah, very much. Where is it present? Nasal septum. Where in the nasal septum? Anterior-inferior aspect. Anterior-inferior aspect of nasal septum. Can I see the anterior-inferior aspect of nasal septum now? Yeah, that you will see, but this is causal back plexus, Little's area of epistaxis. It is in the nasal septum, anterior-inferior, and what is more important is, it is provided by the branches of external carotid artery and also internal carotid artery. You mean to say it is a plexus between two arteries? Yes. Branches of internal carotid artery will join with the branches of external carotid artery here. So it is actually a plexus between the two arteries, branches. Can I see their names, the branches? Yes, that's what we do. But this question has come, which is not a branch of external carotid artery. External, yes. contributing to Kaiserbeck plexus. Yes. I think there are 8 branches of external carotid artery. Yes, you have got your answer now. Sphenopalatine came from the third part of maxillary artery, branch of external carotid artery, and this is the answer because remember, anterior ethmoidal artery is your answer because anterior ethmoidal artery is a branch of the ophthalmic artery. You remember where the ophthalmic artery came from? Ophthalmic artery is a branch of the internal carotid artery. Gave 5 branches, you remember? Internal carotid artery gave 5 branches. One of them was ophthalmic artery into the orbit to supply eyeball, and in the orbit it will give you anterior ethmoidal artery. Though it may be participating in Kaiserbeck plexus, but it is not a branch of external carotid artery. That's why this is the answer. What about greater palatine then? Greater palatine we have already learnt was a branch of descending palatine artery, and descending palatine artery itself was a branch of maxillary third part. So maxillary artery third part, yes, gave the descending palatine artery, yes, and gave the greater palatine artery, yes, and septal branch of superior labial, where it came from, don't you know? Superior labial, branch of facial artery, branch of external carotid artery. So this is the discussion. Yes, a diagram will come now, but keep your answer as anterior ethmoidal because anterior ethmoidal is a branch of internal carotid artery. This is the diagram of Kaiserbeck plexus. So this is the area, anterior inferior part of nasal septum. Yes, anterior inferior part of nasal septum, Kaiserbeck's area, that is area of epistaxis. Some arteries contributing. Which arteries? You see, this is the sphenopalatine artery, branch of maxillary artery third part, which itself is a branch of external carotid artery. So external carotid artery gave you maxillary artery third part, gave you sphenopalatine artery. Yes. Then you know greater palatine artery, branch of descending palatine artery. So there was a descending palatine artery which gave you greater palatine artery. Where the descending palatine artery came from? That was again maxillary artery third part. So maxillary artery third part gave you descending palatine, gave you greater palatine, contributing to the plexus. Yes. And what about the septal branch of superior labial? Superior labial itself came from the facial artery, came from the external carotid artery. Actually, all of them came from the external carotid artery. So these are all branches of external carotid artery. Yes, external carotid artery gave you maxillary artery, facial artery, hence the diagram. But if you are talking about the anterior posterior ethmoidal arteries, they came from the internal carotid artery. How? Because internal carotid artery give you the ophthalmic artery in the orbit, and it is the ophthalmic artery which will give you the anterior and posterior ethmoidal arteries. So anterior and posterior ethmoidal artery is given in the orbit, yes, by the ophthalmic artery, yes, which itself is a branch of internal carotid artery, yes. Okay, can you see that this plexus is actually anastomosis between branches of internal and external carotid artery? It is anastomosis between the branches of internal and external carotid artery. Internal carotid artery, especially anterior ethmoidal artery, you will find that the plexus is mostly contributed by anterior ethmoidal artery, not the posterior ethmoidal artery. Though in some population, posterior ethmoidal artery may be contributing, but mostly it is anterior ethmoidal artery which is contributing to the plexus. Now, a case has come, which is epistaxis. So you want to do some embolism of the artery. You can do some embolism of the artery, especially this sphenopalatine artery is, mostly responsible for the bleed, a severe bleed. So you can do some embolism of the artery. But remember, this question comes when there is epistaxis, severe epistaxis, and you are doing embolism of some arteries, which artery you are not supposed to approach? The internal carotid artery. You can approach the branches of external carotid artery for embolism and stopping the bleed, but you should not approach the branches of internal carotid artery. Internal carotid artery branches are not to be approached for embolism to prevent the bleeding. So mostly they are branches of external carotid artery. Like you can do that in the sphenoparotid artery, which is usually responsible for severe bleeds, epistaxis. That kind of questions come, so be ready for them. So here is the internal carotid artery. Yes, that was. And this internal carotid artery was giving us ophthalmic artery here. Yes. An ophthalmic artery in the orbit gave the posterior thoronal artery, anterior thoronal artery. I think anterior thoronal artery is responsible for this plexus. Yes, because posterior is not so usually contributing. So posterior is not contributing, anterior is more contributing. Yes. And they are both branches of ophthalmic artery. Yes. Branch of internal carotid artery there. Yes. And what are the branches of external? External you have already seen. This external carotid artery, it gave the maxillary artery. And what the maxillary artery gave? Maxillary artery gave you sphenopalatine artery. And what the sphenopalatine artery gave? What? Sphenopalatine artery, it is contributing to plexus. Okay, so this is external carotid artery which is giving you the maxillary artery. This is the major artery which is responsible for bleed. Yes, I am telling you, you can do embolism of sphenopalatine artery, but not the branches of internal carotid artery. Don't approach the branches of internal carotid, approach the branches of external carotid for embolism. This is a question you have to be careful about. Okay, then what is next? What is next is, we'll find out, is a question, and that question is asking something which we already have answered. External carotid artery is not giving anterior thoronal artery, and that was our answer. Now we are going to talk about the subclavian steal syndrome. What is that? Subclavian artery, yes, is stealing blood from circle of Willis. Why? To supply the upper limb. What is happening? There was some stenosis where? Let us see the patient, then you find where. But subclavian steal syndrome is subclavian artery stealing blood from circle of Willis to supply upper limb. But then the brain will have ischemia. Of course, brain will have ischemia. So you have to be careful. The brain will develop ischemia, so you have to be careful. One question has come. It is asking, when there is a subclavian steal syndrome, there is a reversal of blood flow in some artery. Which artery? You say vertebral. Yeah, vertebral, but which vertebral? The reversal of blood flow is in vertebral, but which vertebral? The same side where the lesion is. You mean to say ipsilateral? Yes. Can you show some diagram that it is the same side where the lesion is ipsilateral vertebral artery reverse the blood flow? Yes, let us see the diagram now. And here is the diagram. This is a case of left subclavian stenosis. If you say it is a case of left subclavian stenosis, then there will be left upper limb ischemia. Yes. And because there is left upper limb ischemia, how do I supply the left upper limb then? You can supply left upper limb now by right vertebral artery. But how the right vertebral artery will supply the left upper limb? I think right vertebral artery is supposed to supply the circle of Willis. Yes, actually, right vertebral artery is supposed to supply the basilar artery, is supposed to supply the circle of Willis. But it is not happening now. Why? Because there was a stenosis. So vertebral artery is not supplying basilar artery. Then what is it doing? It is supplying the other vertebral artery. You mean to say right vertebral artery is sending blood into left vertebral artery? Yes. And left vertebral artery is having some reversal of blood flow? Yes. You mean to say the vertebral artery on the same side of lesion. The vertebral artery on the same side of lesion is having reversal of blood flow. Yes, ipsilateral artery will have reversal of blood flow. And where is the blood going? To the subclavian artery. This is called as subclavian steal syndrome. You see, subclavian artery is stealing blood from circle of Willis. The subclavian artery is stealing blood from circle of Willis to supply the left upper limb. This is called subclavian steal syndrome. You mean to say both the vertebral arteries are supplying the left upper limb now? Yes. Then who is supplying the circle of Willis? If both the vertebral arteries are supplying the left upper limb, then who is supplying circle of Willis? It is still supplied by, who? Circle of Willis is still supplied by internal carotid artery. Internal carotid artery. But be careful. You have to tell the patient, don't do heavy manual work on the affected side. Why should I not do heavy manual work on the affected side? What is heavy manual work? Heavy manual work you differentiate from light manual work. What is light manual work? Buttoning your shirt is light manual work. And what is dumbbells? Dumbbells is heavy manual work. Don't do dumbbells now. Why? Because see what is happening. What is happening? See, there was a subclavian stenosis, yes, and there is upper limb ischemia, yes, and you are doing dumbbells, so more blood is required. So at the cost of deficiency of blood in the circle of Willis. Why? Because this time not only vertebral artery will supply the upper limb, but also this internal carotid artery. But how the internal carotid artery will supply the left upper limb? Because you are doing dumbbells, how will it supply the dumbbell area? See, this time now, right, internal carotid artery is telling the circle of Willis, wait for some time. Why? Because I have to supply the upper limb. It will send the blood into basilar artery, into vertebral artery, into subclavian artery, and supply the upper limb because it is doing dumbbells. In that case, if the internal carotid artery, instead of supplying the circle of Willis, supplying the basilar and the vertebral and the subclavian, then who will supply circle of Willis? No one. So you mean to say severe brain ischemia, loss of consciousness? Yes. Severe brain ischemia, loss of consciousness. The dumbbell will fall down and you will also fall down. Loss of consciousness. That is what. So advise your patient, no heavy manual work. Otherwise your brain will die of ischemia. That is what you have to tell the patient. Can we draw the diagram now? Yes, let us draw the diagram. This diagram will not only tell you about the subclavian stenosis, but it will also tell you about the three branches of subclavian artery and the width branches from the first part of subclavian artery. You remember width branches from the first part of subclavian? It will also tell you block of the third part of subclavian artery and the artery supplied to thyroid gland. What? Artery supplied to thyroid gland. You want to supply thyroid gland now here? Yes, let's do that. We start with the heart here. This is the heart. Yes. What is the heart doing? It is giving the arch of aorta. What is that? This is the arch of aorta. So heart has given arch of aorta. What is arch of aorta giving? Three branches. And what are the three branches of arch of aorta? This is the first branch. This is called as brachiocephalic trunk. So you are talking about some heart here, giving some arch of aorta, giving some three branches, and the first branch is the brachiocephalic trunk. Yes. What is brachiocephalic trunk, the first branch of arch of aorta, doing? It is giving two branches. And what are the two branches it is giving? One of them will supply the right upper limb. Who is supplying the right upper limb? It is called as right-sided subclavian artery. Right-sided subclavian artery. Now this is supplying right upper limb. Yes. You are telling this is arch of aorta giving brachiocephalic trunk, dividing into two branches, and one of them is supplying right upper limb. Yes. And that is called as right subclavian artery. Yes, right subclavian artery. Then who is giving the left subclavian artery? Left subclavian artery. Let us find out, but tell the other branch of brachiocephalic trunk. Other branch of brachiocephalic trunk is actually the right common carotid artery. If you say this is the right common carotid artery, then it will supply the head and neck region. If you say this is the right common carotid artery, then it will supply the head and neck region. But there is a left common carotid artery also. Who will give the left common carotid artery? Left common carotid is here, coming directly from the arch of aorta. So this is the left common carotid artery which is coming directly from the arch of aorta. Yes. Similarly, left subclavian artery. given directly by the arch of aorta. So this is the left subclavian artery supplying the left upper limb and is direct branch of the arch of the aorta. Yes, upper limb it is supplying, and name left subclavian artery, and it is a direct branch of arch of aorta. Okay, arch of aorta gave a direct branch left subclavian artery supply the left. I think it was having some problem. Yes, it was having some problem. But before you discuss that problem, can you tell me which muscle divide subclavian artery into three parts? That is scalenus anterior muscle. Where is the scalenus anterior muscle inserting? It is inserting on the first rib. There was some scalene tubercle. Okay, first rib, right. What was it doing? Dividing artery into three parts. What are the three parts of the subclavian artery then? See, this is subclavian artery in the neck region, so covered by a muscle named scalenus anterior muscle, inserting on the first rib and dividing artery into three parts, namely proximal to the muscle, deep to the muscle, distal to the muscle. So proximal to the muscle, deep to the muscle, distal to the muscle. Can it be shown on the right side? Of course. Whatever happened on the left side will happen on the right side also. Let us show it on the right side also. And on the right side you are showing scalenus anterior muscle now. Yes. Where is it inserting? On the first rib. And when it is inserting on the first rib, what is it doing? Dividing artery into three parts. What are the three parts of the subclavian artery? They are: first part proximal to muscle, second part deep to the muscle, third part distal to the muscle, and I want to know first part three branches, the width branches. If you want to know the first part three branches, the width branches, then let me show you width branches. This is width branches. V is going up and I is coming down, and T is going to thyroid. So name. Actually, V is going up. It is the vertebral artery which is supposed to supply circle of Willis. And what is I? I is internal thoracic artery to supply the thorax. It is descending down. So you are telling this is the subclavian artery first part giving three branches, the width branches, and the V is going up. The ascending branch is vertebral artery, supplies circle of Willis. I is the internal thoracic artery going down, descending branch to supply thorax. What is this T to thyroid? T to thyroid is thyrocervical trunk. Now, if T to thyroid is thyrocervical trunk, what is thyrocervical trunk doing? Supplying thyroid gland. Can I supply the thyroid gland now? Yes, you supply, but first you draw. First I draw the thyroid gland now. Yes. And then supply. So I'll supply the thyroid gland now. Yes. Which artery I'll give? Give this artery. Who is this? This is inferior thyroid artery. You are telling that this is thyroid gland in the midline. Yes, thyroid gland in the midline. And it is supplied by some inferior thyroid artery, branch of the thyrocervical trunk, branch of the first part of the subclavian artery. Yes. First part of subclavian artery gave you thyrocervical trunk, gave you inferior thyroid artery supplying the thyroid gland. Then who is giving the superior thyroid artery? Superior thyroid artery. Yes. I'll tell you. You know what is this? What is this? Right common carotid artery? Yeah, okay. This right common carotid artery gave a branch. Which branch it is giving? External carotid artery. Yeah, okay. I know that. After giving external carotid artery, it will continue as the internal carotid artery. Okay, you are telling common carotid artery is bifurcating into two branches now? Yes, you can say like that, or you can say common carotid artery gave a branch, external carotid artery. After that will continue as internal carotid artery. You mean to say internal carotid artery is a continuation of the common carotid artery? Yes, it will supply the brain. Then what is external carotid artery supplying? The head and neck region. How it is supplying head and neck region? Do you remember the first branch of external carotid artery? It will give 8 branches, the first part. You are talking about superior thyroid artery now? Yes, that is the point. Do you remember? Superior thyroid artery is the first branch of the external carotid artery. It will give 8 branches, but the first branch is superior thyroid artery. Now, 10% of people have third artery to thyroid called thyroid artery. What is that? 10% of population has a third artery to thyroid called thyroid artery. Where is that artery coming from? AIMS question. So, this is thyroid artery now? Yes. And where is thyroid artery present? Actually, 10% of population has a third artery to thyroid, which is thyroid artery. Is a branch of. Actually, it is a variable origin. Variable origin means some population it comes from arch of aorta, and other it may be a branch of the brachiocephalic trunk, or maybe a branch of the subclavian artery, maybe a branch of the external carotid artery. Or it has variable origin. Yes, actually. Thyroid artery can arise from arch aorta, it can arise from the brachiocephalic trunk, it can arise from the subclavian artery, it can arise from the external carotid artery. It has variable origin and is prone to injury when we are doing the ischemectomy. Why are you doing ischemectomy? Because I want to put a tube into trachea, tracheostomy. So before doing tracheostomy, you do ischemectomy? Yes. And this artery is at risk of injury? Yes. Midline artery. Means you are cutting the stenosis of thyroid now? Yes. So that you can put a tube into trachea behind that? Yes. And then this artery is at risk of injury? Yes. This question came. What about the inferior thyroid artery? Is it at risk of injury? No. Why it is not at risk of injury? Because it is not in the midline. Your incision is in the midline. So because ischemectomy is done in the midline, inferior thyroid artery will escape the injury? Yes. But thyroid artery will be compromised? Yes, because it is a midline artery. That's why it is compromised. Where is the question you are talking about? It will come. Wait for some time. At this moment, you have to talk about that patient. Which patient? Subclavian stenosis, you forgot? Oh yes, subclavian stenosis, right. This one? Yes. Subclavian stenosis, upper limb ischemia? Yes. And there is subclavian steal syndrome now? Yes, actually. So this is the left subclavian stenosis. But if you are telling this is left subclavian stenosis, narrowing of the artery, this is the left subclavian stenosis, narrowing of the artery leading to left upper limb ischemia, I need subclavian steal syndrome. Now this subclavian steal syndrome, subclavian artery steal blood from circle of Willis. Let us show the circle of Willis. You know, this is the left vertebral artery. And there's a right vertebral artery. Yes. They join to form the basilar artery. Yes. And basilar artery will divide to give two arteries. Which one? Can you see? This is right vertebral artery. Yes, I can see. And this is left vertebral artery. Yeah, left vertebral artery coming from the first part of the subclavian artery with branches. Yeah, with branches, vertebral artery. So first part of the subclavian artery giving the with branches, and this is the vertebral artery. This is left vertebral artery and this is the right vertebral artery. They join to form the basilar artery normally, and basilar artery will bifurcate to give posterior cerebral artery so that they can contribute to circle of Willis. Circle of Willis. So right vertebral artery join with the left vertebral artery, and then they'll form the basilar artery, which will divide to form posterior cerebral artery and contribute to circle of Willis. This is normal. Yeah, this is normal. But something abnormal has happened. What? There is a left subclavian stenosis. So you don't have a blood to send up in the vertebral artery. Why? Because there is a narrowing of artery. Where is the blood? You don't have blood to send into vertebral artery up. So blood cannot go up in the vertebral artery? No. Actually, the blood was coming down. The blood was coming down. Why? Where is this blood coming from? From the other vertebral artery. You are telling that this blood is coming down from other vertebral artery. How come? Because now you see, right vertebral artery is sending blood into not the basilar artery but into the other vertebral artery, and this other vertebral artery will send the blood into where? Subclavian artery and into the upper limb. Ischemia zone. Oh, this is the thing. Yes, because there is a subclavian stenosis, there was upper limb ischemia. That's why you have subclavian seal syndrome, which is subclavian artery stealing blood from the subclavian artery stealing blood from the circle of Willis. If you say it is stealing blood from the circle of Willis, how come? Because right vertebral artery, which is supposed to supply normally, the right vertebral artery, which is supposed to supply normally the basilar artery, is not supplying basilar. It is sending the blood into other vertebral. And the left vertebral is having reversal of blood flow. Are you trying to say this blood is going to reach the subclavian artery? Yes. And supply the upper limb? Yes, that is the point. Right vertebral artery is sending blood into the left vertebral artery, is sending the blood into subclavian artery and supplying the left upper limb. You mean to say both the vertebral arteries supplying left upper limb? Yes, that is what. You mean to say this left vertebral artery has reversal of blood flow? Yes, left vertebral artery has reversal of blood flow, or reversal of blood flow in the vertebral artery, the same side of lesion. So ipsilateral vertebral artery. There is a reversal of blood flow in the ipsilateral vertebral artery. That was your question. That was the question. Is it over? Yes, it is over, but not over. Why? Because you have to discuss the artery supply, venous supply to thyroid still, yes. See, there is some emergency tracheostomy going on and you were doing isthmectomy, putting a tube into trachea, which is not at risk of injury. I think midline structure will be at risk of injury. Of course, you have to cut the isthmus. You got your answer, isn't it? Because we told that inferior thyroid artery is not in the midline. It is not at risk of injury. That is the answer. What were you cutting? Isthmus in the midline. So thyroidema artery was in the midline. It was at risk of injury. Are you trying to say the veins will be in the midline? Yes, they are. Can you show me some diagram, veins in the midline? Yeah, we'll see that. But remember, inferior thyroid artery is the answer. Why? Because it is not in the midline. Okay, so it will escape the injury. Yes. What about inferior thyroid veins? They are in the midline. We'll see a diagram for that. But keep your answer as choice number B. And now this is the diagram which you have already drawn. This diagram I have drawn already? Yes, when? Just a while ago. You have told thyroidema artery is present in 10% of population and it is having a variable origin. See here, it is coming from external carotid artery. It may come from subclavian artery also. It may come from brachiocephalic trunk also. It may come from arch of aorta also. But here it is coming from external carotid artery and it is in the midline. That's why whenever we cut the isthmus of the thyroid, there is structures in the midline compromised. So thyroidema artery can be compromised. This time it was a branch of external carotid artery. It has a variable origin. Okay, fine. What about the inferior thyroid artery? It is not at risk of injury in emergency tracheostomy because it is not in the midline. Is a branch of thyrocervical trunk. Itself is a branch of first subclavian. Actually, first part of subclavian artery gave you width branches. In the width branches, this is the T, thyrocervical trunk, and thyrocervical trunk will give you inferior thyroid artery. Then we will give the superior thyroid artery. Superior, yes. Superior thyroid artery is here, branch of external carotid artery, which itself is a branch of common carotid artery. So common carotid artery will give you, external carotid artery will give you superior thyroid artery. I think after common carotid artery has given the external carotid artery, it will be continuing as the internal carotid artery. Yes, you are correct. It is a common carotid artery bifurcation. But remember, once the external carotid artery has, once the Common carotid artery has given the external carotid artery. Common carotid artery continue as the internal carotid artery to supply the brain, circle of Willis. So common carotid artery continue as internal carotid artery to supply the brain, circle of Willis. Yes, what is external carotid artery doing? It is giving 8 branches. The very first is here, superior third artery.